Welcome to Healthy Life. In for Dr. Timothy Johnson, I'm Keith Ayub. A growing number of people are swearing off foods like bread, pasta, and pizza. They believe that gluten found in all of those foods causes anxiety, acne, and even infertility. Now, joining us to discuss how much gluten affects our health is Dr. Felice Schnolz-Sussman, Associate Professor of Medicine at the J. Monahan Center for Gastrointestinal Health at the New York Presbyterian Hospital. Welcome, Dr. Schnolz-Sussman. Am I saying that right?
Yes, you did. Thank you.
Okay, great. Tell us about gluten sensitivity and this whole business with gluten. It's a lot of buzz here, but really how common is it?
Well, what's interesting is we actually thought this was less common in the past, and it's actually a fairly common issue. Approximately 1 in about 133 people are actually affected by gluten sensitivity or a disease also known as celiac disease. And in fact, if you actually have a family member, a close family member with this process, you're actually at a greater risk, somewhere around 1 in 22.
Now, how does somebody know if they have it? What are the symptoms?
Well, there are a variety of symptoms, and that's often what makes it difficult to diagnose, difficult for both the patient as well as the physician at times. The most common symptoms that are associated with gluten sensitivity is diarrhea, gas, and bloating. But there are many other symptoms associated as well. People might have anemia related to iron deficiency. They could have bone disease. There are people that complain of headaches, depression. There are also skin manifestations, liver disease as well. So as you can see, there are many, many different things, signs and symptoms that may be associated with this.
You know, that's good to bring up because when you've got such a broad spectrum of these sort of non-specific symptoms, doesn't that kind of open the market up for a lot of quackery, and is there a potential to turn this into sort of a garbage can diagnosis?
Well, that's interesting that you bring that up, mainly because, of course, we don't want patients to misdiagnose themselves with the disease process. That's a chronic disease that they will carry the rest of their lives. It's important to discuss any symptoms that you may have that sound like celiac disease with your physician so that a correct diagnosis can, in fact, be made, because there are ways to actually nail down this diagnosis.
And what are some of those ways? Is there a specific test for this?
Well, there are blood tests to look for antibodies that you may actually have in your blood. One is called anti-tissue transglutaminase antibody, and that is typically very high or high in patients that have celiac disease or gluten sensitivity. And then, in fact, if this blood test does come back positive, typically patients are sent for an upper endoscopy to actually get a biopsy of their small intestine to confirm the diagnosis.
And I'll tell you, when we're talking about gluten, let's just pinpoint for viewers where exactly they're going to be able to find gluten.
You can find gluten, unfortunately for people affected with this, in so many food products. So basically what we're talking about is wheat, barley, rye. And as you can imagine, that is so commonplace. So things like cereals, bread, pasta, cakes, cookies. But you also may find it in things like sauce and condiments. And the other thing that you have to be very aware of is that in prepared foods, it's also rampant gluten.
You're right. So things like anything that's breaded, for example, might have gluten on it, right?
Exactly. Things that are breaded, things that may come in sauces, things that come in marinades. So although people who have celiac disease or gluten sensitivity may be able to eat things like fish and poultry and beef, the thing that they have to be also aware of is that the way that the food is prepared may also give them a problem as well.
Now, we always hear about people needing to eat more whole grains. Mm-hmm. Does going on a gluten-free diet mean that you have to eliminate all your whole grains?
Well, the main thing that we're trying to do, obviously, is decrease the stimulus to the intestine. So there are some other things that people can certainly eat. Things like corn is available. Potato is available, rice is available, but certainly things that contain wheat, barley, and rye are absolute things that need to be eliminated from one's diet if they have this sensitivity.
And what about oats?
Well, oats can be controversial. So there are some people that believe that oats should still be eliminated and some who don't. The main issue really with oats is that although when you think about the content of gluten, it's probably not there. Very often, oats are prepared in the same type of factory where gluten-containing products may also be prepared. So if you're able to be very convinced that the oats are not prepared in a similar type of process or in a similar type of factory, then you're probably safe.
And we are seeing major manufacturers of major food products and even food chains putting gluten-free items in their product line or on their menus. Do you see this as consumer demand, or is this sort of playing to the hype?
Well, I think it's wonderful. I think certainly we recognize that, especially in the United States, that most things are driven by the consumer. And that's really how it should be. These are patients or people that have a chronic condition, and they need to be very careful with everything they consume. And the fact that these products are now readily available in supermarkets, even in restaurants, is wonderful to them. It allows them to have a myriad of options that they can go out and enjoy meals like regular people.
And Doctor, I actually know somebody who was diagnosed with a gluten intolerance and actually had no symptoms, but was getting worked up for anemia. So it's not completely clear that you have to have symptoms before you actually have. You can have this without having symptoms, is what I'm saying, right?
That is absolutely correct. There are a certain percentage of people with celiac disease that are absolutely symptom-free. And what's very important, however, is they may have other things, like you said, anemia, iron deficiency anemia, or bone loss, things like osteoporosis, especially at a young age. And those are clinical signs, not necessarily symptoms of this disease process. But it's equally important for those people, even though they may feel perfectly well, to avoid gluten also.
Now, given that there's such a broad spectrum of symptoms related to gluten intolerance and gluten sensitivity, and that there's a quick test, do you think it's worth it, and even that one out of every 133 people may have this, is it worth it to ask your doctor for just a routine baseline test for gluten intolerance?
There's a small percentage of people that could actually have a false positive reading on the test. And then, as a consequence, you would have to go on for an upper endoscopy and biopsy, and these things are not without risk. So although it might seem like a wonderful thing to just do mass screening, very often we try to reserve it for people that do have some signs or symptoms of this type of process. But certainly if you have a family member that is afflicted with this disease, then definitely you should go on for screening.
Well, I'll tell you, that sounds like very excellent advice. Thanks very, very much, Dr. Schnol-Sussman.
Thank you so much.